optimistically things will improve rapidly, but May 8th is not going to be the day for most of our region to open. And what we're going to see is probably other areas in Pennsylvania open quicker, those ones with fewer cases.
Don't forget to smash that share button, subscribe to my page, follow me on Instagram at Lance Bachman, and keep sending me those questions.
Hey, Doc, thanks a lot for spending some time with me today. The big cat's out of the den. But can you give us kind of an update since last week on some things that are going on in the community?
Yeah, sure, Bill. Good to speak with you today.
Yeah,
Essentially, what's been going on, I think everyone is aware that, we're getting close to a reopening of Pennsylvania. So we have a little bit more of a clear-cut guidance about how that will happen. And it goes in phases. So there's a red, yellow, and a green. Obviously, we're all in the red phase. The red phase basically is stay-at-home orders, and only non-essential businesses are allowed to be operational. So in order to move from the red to the yellow, there's certain requirements that they put in place. Okay, so looking at the requirements, it's 50 new cases per 100,000 of that population in the county. So to put that in perspective, for that to happen for Bucks County, we need to go from 109 new cases, which is the average over the last 2 weeks, to 22. So that's about an 80% reduction in cases.
Wow.
Also, we're lumped in this region. Okay, so they go southeastern region. We're lumped in with Philadelphia, which is one of the highest cases around. So, it's unsure if they're going to take this county by county or they're going to lump the whole region together. And I think there'll be, individual factors depending on population, density, capacity of hospitals, personal protective equipment, and the capacity to do testing. So there will be some other factors looked at, but, looking at those numbers, 90% reduction is needed in Philadelphia. So just to give you an idea of where we are and where we need to be, and certainly that can happen hopefully relatively quickly if we continue with these this distancing measures, and optimistically things will improve rapidly, but May 8th is not going to be the day for most of our region to open. And what we're going to see is probably other areas in Pennsylvania open quicker, those ones with fewer cases.
With obviously us kind of staying and being sheltered for like the last 6 to 7 weeks now, one of the big things that's out there is how people are dealing with their mental health and their exercise. What kind of things would you be telling our viewers today as far as what they should be doing and how to keep themselves in the best possible position?
Sure. So, I'll tell you exactly what I tell my patients. Reach out if you're struggling, so there are people that have pre-existing anxiety, depression, and that might be severely exacerbated. So that needs to be addressed, so reach out to family, reach out to your provider, reach out to the resources on the pa.gov site. There are resources out there. So not uncommon, and don't feel like you're alone. There's a lot of people struggling out there.
The business community getting ready to open back up. I'd wonder if you could just touch base a little more on the different phases as far as the red, the yellow, the green. Are these mostly data-driven decisions as it applies to how they're going to go in opening it up?
Yeah. So, if you look at the guidance, basically they're using a data-driven tool coming from Carnegie Mellon University. So you're using that with, the real-time data that's coming through and kind of implementing a policy regarding that. So for the yellow phase, there'll be some businesses that aren't as risky as others. For instance, the gyms, the spas, the wellness fields, those things that require a lot of close distance seem to be a little higher risk, and they're not included in the yellow phase.
As a medical professional, Doc, and us getting ready to go back into that workforce as far as where we are and coming out of the shelter in place, what kind of advice would you give to the viewers to be able to say these are the things you should be looking at as it applies to going back into the job?
Yeah, so I would just defer that to the CDC and pa.gov site. That's essentially, basically, you're looking at a policy in place that you should have before you go back to work, which requires social distancing whenever possible. That's 6 foot distance between people. Staggering office hours, depending on if you can do that with people, staggering break time, temperature checks on employees as they come through, a mitigation policy in place in case there is an exposure within the office. If there's a positive COVID patient, we need to have a strategy in place of what to do after that. Surface wiping with disinfectants and sanitizer, and having masks worn at all time by employees, and providing those masks to those employees.
Dr. Luciano, thanks a lot for being on the Lions Den today, and I appreciate the opportunity to spend some time talking to you about things that are going on, and we wish you and your family a safe rest of the remainder of the weekend.
My pleasure.
All right, thanks a lot, Doc.
So, it's the message that we're hopefully having this theme of, we're all in this together. So there will be eventually, probably won't be May 8th, but soon after, hopefully, as we get those caseloads down, that will be, again, all in this together. Some people will be allowed to go back to work. The public will be less restricted in going out to public places, but still that social distancing is what got us into this phase a little bit quicker than expected. So hopefully people look out for one another, follow those rules, and we continue to move on different phases, but understand that that could change in an instance where we go backwards, and then we have the seesaw back and forth. So take care of yourself is the other thing I recommend. Reach out to your provider if there's any health issues, because that's important, and know that they're available via telemedicine and alternative measures.